Okay, we're rolling. This is Dr. Scott Geller in Fort Myers, Florida, with a great floater patient, a colleague from the state of Maine. And when did you have your posterior vitreous detachment, your PVD?
I had one occur about 6 months ago, and the second one occurred about 2 months after that.
And when did you have your cataract surgery?
I had that about a year and a half ago.
Year and a half. And that's not uncommon because there's a little more wiggle room. But what you had was this obnoxious hyaline opacity. See that there? And in your field, you have to have very precise vision to see what's going on. And that was basically, was it more of an annoyance factor, or did it blur your vision occasionally?
Occasionally blur my vision. The main concern was work, though, because I do have to have precise vision, and when you're dialing someone's eyes, you have to know which floaters are theirs and which are yours.
Of course.
Yeah. It got very
Of course,
annoying.
of course. Well, anyway, we got most of it in the first laser session, but these are a little tricky sometimes, and your vitreous is, I'd say, 99% clear elsewhere, except for the normal configurations. That little piece escaped. The second laser was a little tough to get that piece because it was very close to retina, but the third session, I wouldn't say magically, but it became more mid-eyeball. And I basically got it correct. There might be one or
Yeah,
two
the large
pieces.
central one is gone.
It's
There's
gone.
A little
It's
bit
gone.
of peripheral stuff.
It's gone.
Doable.
And there's always stuff in the vitreous when you have a PVD if you look hard enough, but you don't notice it in normal activity unless you're looking against a background that's white or something like that, would you say?
Correct, yes.
Okay, so you're a happy patient. That's what we like.
Yeah.
And you came all the way from Maine. Now you go back to the cold. There's a big cold snap up there. You know that.
Oh, yeah.
It's still 70-something degrees here in Florida.
And it's 18 at home, and we're getting 5 to 8 inches of snow tomorrow.
Exactly. So I think you should show this to your ophthalmic colleagues up there and your OD colleagues. They certainly would find it interesting because they say this can't be done. It's impossible. How can they do that? They don't do it at Mass Eye and Ear. And, they know everything at Mass Eye and Ear. You're in their orbit, correct? The Mass Eye and Ear orbit,
yeah.
more or less?
Mm-hmm.
Yeah. But we do it here, and we know what we're doing. You're a great patient. Have a happy Thanksgiving.
Thank you.